Good afternoon, everyone. Thanks so much for joining us for our first in the series of corporate compliance for FQHCs. Today we have with us presenting Mr. Bill Carberry from Peak Performance, and we've already gotten a couple of questions in, but I wanted to let you know that we will be sending out the presentation slides after each of the compliance sessions. The first one is today. We will be holding 6 more sessions on a monthly basis on the last Wednesday of each month from 12 p.m. to 1 p.m. So if you have registered your email addresses for this session, I'll make sure that you get an invite to the remaining sessions so you can join us. Thanks so much. Without further ado, I will turn the presentation over to you, Bill.
Thank you. As she said, I am Bill Carberry, and I work with Peak Performance Physicians, and we have been doing corporate compliance plans with some of your folks, and we decided that we would offer out through this Compliance Institute because I basically believe is that that telling somebody that they need a compliance plan is like telling them they need a financial advisor. Is that I have no idea where to start. So we're going to start this way. And one of the first things on compliance is that everybody thinks that the compliance officer is someone who gets you into trouble, when in fact the compliance keeps you out of trouble. Because if you know how you're supposed to be doing things and you see something is being done wrong and you report it to a compliance officer, then trouble gets averted. It's when you see something that's wrong and you just sit on it and then it becomes a bigger issue, that's when trouble starts. The Institute is a cooperative between Peak Performance and Louisiana Primary Care, and our main goal is to assist you in establishing an effective compliance plan. I put the syllabus up here on this, you'll get it, because then you'll see what we're going to be talking about each of the weeks, and then you'll be able to get a little bit of information about that prior to the meetings, or we can just wait for the meetings. But this is what we're going to be discussing, and as Christine said, it is going to be the last Thursday of every month. With all the compliance programs that I have been talking to, or I see presentations, or I see the books or anything, is that basically it always starts with all the things that they're going to punish you with if you're not doing it correctly. And I want to start this the other way and say that compliance is really, it's just what you're doing right. Let's not worry about the punishments. Let's just start talking about how do we do it right. And I honestly believe that everybody who comes to work is coming to work, and what they want to do is they want to do the good job every day like they're supposed to. I generally don't believe that anyone gets up in the morning deciding I'm going to go do something fraudulent today. I live my life in rainbows and unicorns, so I just honestly believe that. So what is a compliance program? And this is the definition from the Office of the Inspector General. It's an effective, practical, integrated management tool that establishes clear and defined goals and procedures designated to create a culture of compliance, reduce the occurrence of mistakes, prevent intentional violations of applicable healthcare statutes and regulations. And it applies you with tools for acting ethically and maintaining compliance with the applicable laws and regulations. Now, in our goal it's creating the culture of compliance by showing a commitment from senior management and enforcing it all the way down. The benefit of the program is that by focusing the attention on the processes and reinforcing the standards through the audits and training, we'll be able to improve the quality of care. And then the second benefit is that if you detect errors, you see errors that occurs, you'll be able to keep errors from being significant and crippling fines and penalties. Just as an example is that right now one of the things that the Office of the Inspector General is doing is they're looking at place of service codes. And we were looking at, with one of our clients, we were looking at some of the codes that we were doing, and lo and behold, we found out that it was being coded as an office procedure when in fact it was an surgery procedure. So we found it early, we're able to correct the few that we did have, and we're going to be able to go forward, and now we know that there's a problem. And it was just simply because we did a very quick audit on our place of service codes to make sure that they were correct. Now, for those of you who don't know what place of service codes are, we'll get to that later. For those of you who do, go back and look at it to make sure that that's doing right. In the tools for compliance is your compliance office and your compliance committee. They're the ones that will allow you to clarify the requirements or to report a problem. It says our audio connection went out and came back in, so hopefully you all can still hear me. But utilizing, and then the written policies and procedures are really one of the key lines that you have for doing the thing the right way. And then being unafraid of talking to your manager and other staff leaders and so forth about something that you think is wrong or that you're not sure how it's supposed to be done. That's the easiest way to, to make sure that you have a culture of compliance. And just want to warn everybody, not everything that you do wrong is illegal. It's just sometimes you just do it wrong because you thought that was the way it was supposed to be being done, and then somebody finds it wrong. So I try not to use the word illegal. I try not to use the word fraudulent. I try not to use penalty. I try to use things of, this is what I was taught to do. I didn't know it was wrong. Let's correct it. So that's what we need to do. I put this slide up here, and when you get the copies of the slides, and whether they're electronic, or is that these are the three major regulatory agencies that we've got out there, which is the Office of the Inspector General, the Health and Resources Service Administration, HRSA, which is almost specific to you all, and then the Office of Civil Rights.
Bill, sorry to interrupt. Apparently someone on the line that I'm unable to mute their phone. They may be using computer for audio, and there's a lot of background noise. So would anyone who is not muted on their phone please attempt to do so?
Sounds like you're washing dishes.
Thank you.
I wanted to put this slide up because when you go to this slide, and it is very difficult to read on the slide, but what it does is that it takes you directly to what the compliance guidance is, and you'll see that I've just highlighted this about the OIG, and you see it's on the compliance, and then it just gives you the compliance guidance, and the next slide actually looks like the next slide actually shows what happens under that. So we're under compliance. We're under compliance guidance, and then we finally get to the supplemental program for nursing facilities, and then this is for PHS research, and right below here is where we get it for physician offices.
Voicemail of Shannon Robertson with the Louisiana Primary Care Association. I am unavailable to take your call at the present time. Please leave a detailed message and I will return your call. If you need immediate assistance, please dial extension 200.
Begin recording at the tone. Finish by pressing pound.
Okay. So I wanted to show you that's where we get this, all of this information is from the compliance guidance, and that is the link, and that's what the page looks like. Now there's a whole bunch of other things on there which we will get to in later things, but I want you to get oriented just to this page so you can pick up the client, and what you're looking for is the compliance guidance for small and solo practitioners and physician written in corporate, in Federal Register language and type, so it's not very easy to read. However, the key elements of a compliance plan is conducting internal monitoring and auditing, implementing practices and standards, designating an officer, conducting appropriate training and education, responding appropriately to detect offenses, developing the open lines of communication, and enforcing disciplinary standards through published guidelines. Now, that seems like a big chunk to take all at once. It's not as difficult as it appears if you eat it a little bit at a time. But those are what those standards are. And today what we're trying to look at is who are these people, what are they going to be doing, and in the next group of slides we're going to be going through how to do it and actually try and walk you through one by one on each of these things, okay? Under the OIG, one of the things that we are supposed to be doing is we're supposed to be checking our employees to see whether or not they have been excluded from federal programs. This has become a very interesting thing. It's in the same place, so you go to the Office of the Inspector General, and right next to it is the exclusion. And then the next slide, then it just shows you where to go to online searchable databases, the LEIE. So those two you're supposed to be checking to see whether or not someone who is working for you has been excluded. We will go through this exclusions in much more excruciating detail because it is actually bigger than what you think, because everyone is supposed to be tested to see if they've been done. And unfortunately, what the current regulation is that it has to be every 30 days. Now, if you're a small group and there's 8 people checking this, is not too bad. If you're a large group with 200 people checking every 200 people every 30 days, it is a problem. But we'll work through that and we'll show you some solutions to that. The next group is HRSA, which is the Health Resources and Services Administration. And I bring you the HRSA because HRSA is where your conditions for participation are. The next slide after this is you go to the health centers. You see where it says health centers, and you click on that. You come to the health center requirements, and when you click on that, it gives you all of the things that you're supposed to be doing. There's 19 questions that have to be answered. We're going to be sending you all these 19 questions as a gap analysis that you can complete on your own, do a self-analysis, or you can discuss it with us, or we can help you do the analysis however you want to do it. But there's 19 things that you're supposed to be doing in order to be an FQHC. And the real honest answer is if you're not doing those 19, you maybe shouldn't be doing what you're doing. And so, or we need to correct that. The next one is HIPAA. And everyone talks about HIPAA, and I will tell you that HIPAA started, I think, in 1994, and we still don't do it right. The other day, I received an email from someone who was forwarding an email from someone who was forwarding an email from someone that had 2 to 3 pieces of protected health information, and it was not a secure email. And and I can't believe that since 1994 we still can't get that right. I was auditing another office, and the office manager said, I said, well, tell me about your email. And she said, oh, we don't use it often, but I use it to send all the medical records to Blue Cross because they can't seem to get the faxes. So she had sent about 15 or 20 complete medical records over an unsecure email. This was in 2016, and the rules said in 1994 you couldn't do that. So I give you that. This is what we want to look for. Okay. So here's what these 3 things do. The OIG enforces compliance, and the work plan for the Office of the Inspector General includes the enforcement of the 340B program. HRSA enforces the conditions for coverage, and they are just now starting where they are going to be, they've just been, this past year, they've started doing face-to-face audits on the conditions of coverage. They're actually coming out to your place with an auditor and trying to get these conditions of coverage to see whether or not you're doing what you're supposed to be doing. And then the OCR, which is the Office of the Civil Rights, are now coming on site, and they're doing face-to-face audits on security and private health information. Now, Louisiana is listed as one of the states that has a lot of problems with the federal government. There are 7, and we call them the Magnificent 7. There are 7 states that are constantly being investigated. Florida, where I live, is one, and Louisiana, where you live, is another. And it is because they have a high incidence of fraud occurring in these states. And so therefore, if any has, and Christy, you can just ask the question and they can raise their hands. I think you can see it. Has anybody received a notice for a face-to-face audit by either HRSA or OCR yet? And, and if you have, we'll talk, please let me know so I can talk with you about how that went so we can do some further education to the rest of the group. If you haven't, then we just need to be prepared because they are rolling them out this year, both.
There was one hand raised, Bill.
There was one hand raised, okay. And if you know who that is, I would love to talk to that person to see what it was like and who it was and how much they enjoyed it. I got to spend a year with the FBI over a couple of issues that they had with an employer of mine, and I want you to know I really, really enjoyed spending that year with the FBI. That was a lot of fun. So in building the compliance programs, what we do is we conduct a risk assessment. You conduct a risk assessment, and so what you want to do is you want to look at those 19 things and see which ones I'm not doing and what do I got to do to get them cleaned up. And then you have to do it by priority. There's also others that we're going to go through and show you what some of the other things are. Develop a compliance program. Now, I have said publicly to your group, anybody who says that they can sell you a compliance plan for $50, you probably shouldn't buy it. Simply because your compliance plan is your compliance plan. You may be similar to someone else's compliance plan, but it's not the same. So it's one of those things is that if you buy a canned compliance plan, then we need to go through, you need to go through and modify it so that it fits your particular circumstance. And then we have to make sure that you follow what you say you're going to do in your compliance plan while you're meeting all of the big goals for a compliance program. You implement the program by working with the attendees, personnel to integrate the compliance functions into a day-to-day routine with audits and assessments. Because just as soon as you finished an audit is that you're wrong, because the next day somebody started doing it completely different. So the next steps for you all is that if you're going to establish a compliance plan is you need to appoint a compliance officer. You have to have a compliance hotline. And I have coding hotline, which actually is supposed to be a compliance hotline, so I'm sorry. Review the compliance guidance, review the compliance plan, review areas of greatest risk, and perform a gap analysis, and establish your code of conduct. And the code of conduct is what's really going to decide exactly what you do and how you do it and how you're going to discipline people if they don't. You have to say to them, we expect you to do this. Now, we have compliance already because we say that our nurses are supposed to wear scrubs and our people are supposed to dress nicely, and we're not supposed to break this rule. We have all of these different things which are a part of the code of conduct. But the second part of the code of conduct is shouldn't take bribes from anybody. We're going to act like we're going to act in accordance to the law and governance. So you need to write a code of conduct. If you don't have one, if you have one, review it and see whether or not it still makes sense. And those are all of my slides. So I know that we have plenty of time for questions. I said it would take me about a minute per slide, and it took me about a minute per slide. So we're going to go from there. I'm going to go back to this fourth slide here. that shows you what we're going to be talking about over the next few weeks, which is the compliance officer. We said we need to appoint one. Now what we need to do is we need to say what the definition is, the code of conduct, what it should be. And then the risk assessment, we have picked about 5 areas that we think are really, really important to you all as FQHCs. And so those are the ones that we have listed below, which is 3, 4, 5, 6, and 7. So now I'll just throw it open to questions.
Okay, if you would just raise your hand if you'd like to ask your question verbally. We can unmute lines one at a time. And the first hand raised is Georgia Johnson. Georgia, I'm going to unmute your line for you to ask your question.
Hey, Georgia. Georgia?
Georgia, it's saying your line is self-muted. If you'd like to ask a question, please unmute your line. Okay, let's see. We have just lots of questions about when the slides will be available, and I will email them out directly following this presentation. For the next sessions, we'll make sure that we get them to you at least the morning of the next presentation, if not before then.
Right, right.
Okay.
Because we'll have that.
Go ahead. Sorry.
I was going to say, because we will have on the next ones is that with the roles and definitions is that having them in your hands is probably going to help you make notes on them and what you should do. It may just arise more questions.
Gail Williams-Dunn, your hand has been raised for a little while. I'm going to unmute your line. If you have a question, please go ahead and ask it.
Hi. My question is around OIG and the 30-day rule. Is that checking all staff? Is it provider staff? Is it staff and board?
I'm sorry, I didn't hear that clearly. Christine, did you hear that?
I'm sorry, Gail, please repeat the question.
My question is around the OIG audit, the 30-day check. Are we checking the providers only, or are we checking all staff, or are we checking providers, staff, and board members?
The regulation actually says everyone. They do not want anyone who is working with you in any capacity to have benefit of any Medicare or Medicaid money if they have been excluded from the program. So that would include housekeeping, that includes janitorial services, that includes any and all. And the board members specifically and the practitioners specifically should be checked, but it's any and all. So if someone gets a paycheck from you, you should check to see if they've been excluded. Okay?
Okay, thank you for your question, Gail. The next question up is, will you all share OCR requests? And is there something similar to the OSD document checklist from HRSA reviewers?
Yes, there are. The OCR for the HIPAA, there are some self-assessment plans, and we have some self-assessment plans, and we will send those to you on before or after. We haven't decided whether it's going to be before or after the program on that, but yes, we will.
The next question is, aren't vendors included in the OIG checks?
Yes, indeed. Vendors are also included. It literally means anybody who comes in your, the literal translation is anyone who comes into your organization for any reason. And it can be if you have an outside service. The seminar that I went to said the guy who mows the grass on your property, if they've been excluded, you should not be working with them. Now, how are people handling that is that when they sign their contracts with outside vendors, is that they are adding new language to the contracts, and we'll get your attorney to add the language that says that you have your that they have agreed that they are not employing anybody who's been excluded from the Medicare and Medicaid program. The second, the second part of this exclusions list is that when you have a business associates agreement, is that your business associate agreement should also say is, for example, I am a consultant and I can't be excluded from the program if I work with you. And so your business associate agreement has also got to have language that says that they are not employing anybody who has been excluded. Now, when we say anybody who's been excluded, it doesn't matter whether I work in your shop or not, is that if we have employed someone with peak performance who has been excluded from the Medicare Medicaid program, you are not supposed to be doing business with us. So it is a very insidious rule, and it is, there's one part that I've left out, is that because I don't want to send anyone into a heart attack, but it actually says that it has to be checked every 30 days.
And we have a comment from one of the participants who states it's important to note that the OIG requires exclusion and sanction checks, but providers need to also check the state exclusion databases as well. The reporting and retention requirements for state programs are often different than the OIG.
And there's 36 states out of 50 states that actually have a way to electronically check it, and there's also 4 U.S. territories that have to be checked. That if you follow this thing to how their regulation is, it is everybody every 30 days in all 50 states, but only 36 of them have it done electronically. And as I was saying, as we go through these exclusion checks, is that which you'll see that's in month 5 where we're talking about exclusions, is as we go through these exclusions checks, is that there are people out there who do this electronically and for very little money, and it depends on the size of your organization as to whether or not you can swallow it. I think that starting with your BAA agreements, your business associate agreements, and making sure they have that, and then reviewing your contracts to make sure that your contracts have notice in them that they do not employ anybody who has been excluded. That's a great step. And then you all doing checks on your employees as frequently as is practical for you until you can get to a 30-day program would be great.
Bill, another question is Louisiana one of the 36?
Yes, it is. Louisiana is one of the 30 states that has an electronic check that you can do. The bad news is that Louisiana state is sometimes between 60 and 90 days behind in actually doing those exclusions, which is why they came with the every 30 days. Is that someone could be excluded today and it may not show up on that on that website until 90 days from now. So yes, they do have it. They're not always up to date.
If there are any other questions, you can either type them in the questions pane or you can raise your hand and we'll unmute your line.
And remember that the main purpose of this today was an introduction into compliance and to just give you all what we're going to be doing over the next few months. You're welcome to call us at any time if you want to skip ahead because we have all of this information available now. but we were trying to figure out how to get it to you all in a digestible form, and we figured once a month was probably just about all we could do. Just think now is that if you went back and for the next month try to figure out how you were going to do exclusions for all of your employees, it's going to take a while for you to do that. So that's kind of why we set the program the way we did.
The next question, Bill, is if Louisiana is delinquent, are we okay as long as we check every 30 days?
If you, that's one of the things is that you check, and there will be, you'll check and you'll check people, and there will be a thing where you can print off or you do a screenshot that says Bill Carberry is not on that exclusion list. Is that is proof that you checked and they were not on that exclusions list. And if they show up later and you find it, and then you discipline them accordingly, appropriately, according to your rules and regulations and what the feds want you to do, then I will say yes, because you've done everything you can do. I don't know what else you could do. So we've been told yes by checking it, but make sure you don't just check it and say, okay, I checked it and I'm done. Is that make sure that you have some sort of documentation that can prove that you looked at Bill Carberry on March 30th and he was not on the list on that day.
Do you by any chance have the website or the link for the Louisiana checklist?
Yes, I do, but I don't have them handy on me right now because they're hidden in a file for the next time. And I will look that up and I'll send it to you, Christine, and send it to you so you can send it out.
Okay. Next question is, does each organization need their own separate BA, or does one BA document suffice between the two organizations?
If you are the one who is hiring, you're supposed to have a business associate agreement. If they're getting services from you, then they have to have a BAA from you.
Next question is, if you have received a date for a HRSA review, what would you recommend being the starting point for preparing for the face-to-face review?
My recommendation would go to that HRSA website and pull up the 19 things that you've got to do a gap analysis to see if answer all the questions, and every place where you say no, we're not doing this, put together a work plan on when you're going to address the issues and how you're going to address the issues, and have all of that prepared for them. Because if they say, I think one of them is that you do an annual assessment of your necessity to be an FQHC. And if you have not done one of those annually, then you just need to say that this is in the works to be doing this. Just how do you intend to solve that problem? I would also see if you have appointed a compliance officer and let that compliance officer handle all of that.
Okay, thank you. We have had a couple of websites submitted by folks on the line, so we'll get out those web addresses to you, as well as what Bill can provide. The next question is the exclusion verification one person per page? The volume for us would be 200 per month. How should these be filed? Now you're just asking an opinion, is that should it be, no, it does not have to be one person. It doesn't have to be one person per page. I think that's what you're going to find, unless you use some of the other sources that have multiple people on a page, is that if it's one person per page, you have two options. You can either file it in their personnel files, or you can file it in your exclusion list file along with a copy, I would say, of a payroll for the month, so that you can show that all of the people that were in payroll listing or human resource listing, they were checked. There's no good way to file that and retrieve it, but
we in healthcare have to do that all the time with our tuberculosis testing and our flu shots and so forth. So we have a way of retrieving data that we want to store. But one page, one person, no. Multiple, multiple people on a page, yeah. But you just have to be able to get it and be able to prove that person was working there and that everything is fine.
Okay, next question. Can anyone in the organization check the website for exclusions, or is there a designated person, such as a compliance officer, who is responsible for checking exclusions every 30 days?
Oh, I can do it on Christine right now. It is a wide open Wild West. What you should have in your compliance plan is who is going to do it, who's responsible for it, and how frequently they report it to the compliance officer or the compliance committee. And that report is that we checked all 200 people. None of the 200 were on these websites, and then that's the report. And then someone will have the documentation for that. So anyone can do it. It's the reporting what gets reported up and who does the reporting that becomes important.
Okay, thank you. And next question. From a human resources perspective, if you check and someone from your agency is on the list, do you automatically terminate that individual, or what is the process? I'm going to default to your personnel policies and your attorney, but the feds say they can't work there. Now, there may be something where I'm Michael William Carberry, and I'm also Bill Carberry, and we have a responsibility to make sure that Michael W. Carberry and Bill Carberry, neither one have been excluded. But if there was an error, your attorney may say that they have an opportunity to cure, or they're placed on a leave of absence until it goes through a review, and then something happens. I'm going to leave that up to you all. But the guidelines say they can't work in your place. They cannot draw a paycheck from you. But I think you're going to need to develop your own process, which is, do we send it to the attorney to have them review it? Do we give them an opportunity to explain or cure, or do we just terminate? I think that's individual. That's why I can't send you a compliance plan. I can, but then we have to work it. Okay, Bill, the next question is, where can I locate the HRSA assessment guide?
Okay, on this slide right here, okay, on the first page, it says HRSA program areas. Are we all seeing that slide? If you can all see that slide, is under here, it says health centers. Right where
no,
where my mark is.
I'm not seeing that slide, Bill.
You're not seeing the slide?
No.
Okay, well, I didn't cut anything off. What do you see?
Seeing just the first page of the session.
Okay. Audience view 100% screen share. Show my screen.
Okay, it's up now.
Okay. All right. On the HRSA website, which is where did I go? There we go. On the HRSA website, health resources, the .gov index HTML, is that this is a screenshot of the first page, and down here at the very bottom you see a thing that says health centers, and then when you click on health centers, you come here and it says health center program requirements. Click on that, and that's the 19. We could actually do that if you want. I'll minimize
Bill, your screen is still on the compliance sheet page.
It says the screen is paused. There we go.
Okay, now you're there. You're at the HRSA.
I'm there at HRSA.
page.
Down at the bottom, it says health centers. The next page says health center program requirements. Click on that, and there's the 19 page. There's the 19 issues right behind that. If you want, I can go to it on a screen and just show you how to get to it. But that's it right there.
And this will be on one of the slide decks, so you all will get it right after this presentation. The next question is, how long do you retain the exclusion check information?
No one has said. No one has said. I think Medicare audits can go back 7 years. I think they can go back 7 years. So I would say 7 years, but then you also look at what your for your personnel policies is how long do you retain employment records for people, and I would basically, whatever that says, that's what I would follow. But that's something that I can't answer. I think that's up to you. There's no one has said what it is. Just remember, you have to prove they weren't. So how long is that? And if you keep personnel records for 7 years, then I would keep them for 7 years. If you keep them for 20 years, you keep them for 20 years. I can't remember if the state of Louisiana has a, in your records retention policy that you have, if you don't have one, you need to get one, and it would be as long as that.
Next question is, so the data can be extracted with multiple names to a page. Is a monthly statement of verification to the board of directors recommended?
It would go to your compliance committee, and your compliance committee will decide how they report that. But for me, is saying to the board of directors or your governing authority that says, we have checked all 200 people and none of them are excluded, I think that is sufficient for reporting up to the board. If they want further detail, then obviously they would have it. But as long as we say we've done it and we've made that report, and then all of the documentation that can support that report is available, absolutely. I think that's fine.
Okay, there are no further questions coming in. So unless there's any late arrivals, I think that we've had a very good session today. And Bill, I thank you very much. Would you all please just keep a lookout for the invitation to register for the next session, which will focus on getting ready for compliance. Specifics on that will be related to designating a compliance officer in your organization and that person's role and responsibilities, the code of conduct that you have in your organizations regarding board approval, risk assessments, the top 5 risk areas, discussion on compliance hotlines, and a sample FQHC annual compliance plan. So we hope you will join us for that session, which again will be the last Wednesday in April, which will be April 27th from noon to 1 o'clock Central Time.
And the person who is going to have that, the person who has received their OCR, or I mean the HRSA thing, if they can just call me or at that number or whatever, I'd love to talk to them to see where they are in the process or if they've already gone through the process. So if those were 2 separate people, one that's going to get one and one who has one, if both of you all would call me, I'd love to talk with you to just see what's going on so we can incorporate this to educate everyone.
Okay, I'll check with those individuals and see if I can forward their names to you.
Well, thank you, ma'am.
Okay, great. Thanks everyone for joining us. Have a great afternoon.
Thank you.
Bye-bye.